Good evening and welcome to the first in our biggest education series yet. I'm so excited to kick off the new International HHT Guidelines webinar series with tonight's topic, Guidelines Overview and My HHT Care. I'm Nicole Schaefer, Director of Professional and Medical Programs for Cure HHT. And to make tonight's event as interactive as possible, I just want to introduce you to Zoom and show you around a little bit. Everyone's microphones have been muted, and this is just to reduce background noise. The video, everyone's videos are off except for the speakers. We have two buttons at the bottom of your screen. One is Q&A, and this is where we would ask you to post any questions to our speaker. And we'll ask as many questions as time allows. But we just ask that you keep the questions in a general nature so they benefit everyone, but also to be related to tonight's topic. Then there's a chat button, and this allows you to chat within the panel and all of the attendees. I will be posting links here to help you navigate to different places on the website or things that we're talking about. So this is really informational, and I would ask that you not put questions here if possible. And then also just to let you know that we are recording this webinar, and it will be in our resource library tomorrow. And then if you have any questions, you can always contact Cure HHT at this phone number, our email, and our website. So before we begin, I just want to give you a little bit of background on the International HHT Guidelines. In 2008, Cure HHT hosted the first International HHT Guidelines Conference, which was led by Dr. Marie Faughnan, and produced the first internationally recognized HHT guidelines in 2009. 10 years later, Cure HHT hosted the Christopher McMahon Memorial International HHT Guidelines Conference, which was only made possible by a very generous donation from the McMahon family. And this event was led by Dr. Marie Faughnan from the University of Toronto, Dr. Stephen Hetz from the University of California, San Francisco, and Dr. Hans-Jürgen Mager from St. Antonius Hospital in the Netherlands. And it involved over 60 HHT patients and physicians from around the world. The result was a publication of the second International HHT Guidelines in the Annals of Medicine in September 2020. And Cure HHT created fact sheets for each topic area, along with the guidelines recommendations, all of which have been bound in this comprehensive guide to managing your HHT. If you haven't received this first complimentary copy, let us know by completing the Join Us form on our website, and I will include that link in the chat. So now I'd like to introduce our speaker, Dr. Marie Faughnan. Dr. Faughnan is a pulmonologist and director of the HHT Centre of Excellence at St. Michael's Hospital in Toronto, Canada. And as I mentioned, Dr. Faughnan chaired both international HHT guidelines conferences and played an instrumental role in the publication of both sets of guidelines, making her the perfect choice for this guidelines overview. I now pass the program over to Dr. Faughnan.
Thank you so much, Nicole. And sorry, a message just came up as I was trying to share about who can share. There's a bit of a problem now in terms of sharing my screen. Ah, there we go. Thank you. Okay. Thank you, everybody. Thank you for this opportunity to speak to all of you about a topic that, as I think you can imagine from Nicole's intro, that I'm very passionate about. It's something that I was very excited to be able to lead both the first guidelines process and the second guidelines process, and to interact with the patients and experts that were involved with both processes in our overarching endeavor to really set the standard of care for HHT care across the world. So before starting to talk specifically about the guidelines, I'm just going to show this one slide in lieu of background. mostly just to review the terms. So of course, by HHT, we mean hereditary hemorrhagic telangiectasia, and HHT is an autosomal dominant genetic disorder that's characterized by vascular malformations. And the small ones are the telangiectasia, which you can see here typically on the lip and finger of these patients. And the larger ones are called arteriovenous malformations, or AVMs. I know that I'm speaking to a very well-informed audience, but I wanted to at least define these terms before we launch right into the guidelines story. So the second international guidelines, as Nicole mentioned, was a process that was started in early 2019 and culminated with the publication of the guidelines in 2020. I'm going to talk to you over the next few minutes about what the guidelines process was, how we went, what the steps were that we went through, and the highlights of that process over the year plus that we developed it. And then I'm going to talk about how to access the guidelines, how to, in the broadest sense of how should clinicians access the guidelines, how should we make sure that guidelines are accessed so that they change the standard of care for patients. In other words, how do we bring the guidelines to your doctors, to your team, so that you're receiving HHT guidelines standard care. So the highlights of the process. First, we surveyed the international community, patient and medical and scientific community, to prioritize topics. Then we involved HHT experts and patients from 15 countries. It was very important to us to use rigorous methods and process under the guidance of expert methodologists, like guidelines methodologists. We followed the agreed to framework and grade methodology, which I won't go into in detail, but we followed what are considered the 2020 standards for developing guidelines. With this process, we generated 36 clinical care recommendations in 6 priority topics, and we published the guidelines in a high-impact journal, the Annals of Internal Medicine. As you may know, there are thousands of medical journals out there, and Annals of Internal Medicine is the number 6 in the world. So this was a very important step for us to publish in such a high-impact journal in terms of disseminating the guidelines. But even further than publishing the guidelines in a high impact journal, we have taken a number of steps during the process and since the publication to make sure that the guidelines are easy access. We've made them open access, and we've developed a website and other tools that I'm going to talk to you about to help bring the guidelines right to patient care. So let's talk for a few minutes about the panel. I did mention that we had representatives on the panel from 15 countries, which was very important to us to have as many countries involved as possible, so that we would be able to disseminate the guidelines not just in 1 or 2 countries, but across as many countries as possible. We included HHT experts from all the relevant medical and surgical and imaging specialties, and also genetics and nursing and pharmacy, et cetera, and other healthcare workers. And this was, particularly important given how HHT affects so many different parts of the body. So, from nosebleeds to telangiectasia of the skin and the mucosa, to bleeding from the GI tract, to affecting the liver, the lung, the brain, the spine, sometimes pulmonary hypertension. Most people don't have all of these things, but of course, these are all the possible things that can happen in HHT. And so we needed to make sure that when we developed our guidelines, that we had experts in all of these areas. And we did. We were very, very comprehensive in the panel. And actually, here's a photo of the panel from the HHT Guidelines Conference, which was the culminating meeting at the end of the whole process. And we held that meeting in November 2019 in Toronto, and it was funded by the Christopher McMahon family and Care HHT. And it was amazing because we were able to bring together all these experts and patients from 15 countries, and in person together go through our final stages of the guidelines development and recommendations approvals. thankfully we planned this in November 2019 and not a few months later, as it probably would have ended up a very different process if it had been in 2020. But we met safely in November 2019, and thankfully. So, as I mentioned, we had experts from all the different relevant specialties, and we also had experts in guidelines development, because we wanted to make sure that we developed our guidelines with the best possible rigor and methods, so that we could publish it in a high impact journal and disseminate it widely and have it be accepted. And finally, we included HHT patients and patient advocates. And we did this in the first guidelines as well. And this was very important to us, because part of, not only did we want to make sure that we are asking all the way along, asking the right questions that were relevant to patients with HHT, and that we were addressing the priority clinical concerns, but also we wanted to incorporate patient values in our clinical recommendations. And so we were very appreciative of the patient involvement in our expert panel committee, and they participated in every step of the process. So what about the process itself? Well, as I mentioned, we had a pre-conference process that ran through most of 2019, and then the guidelines conference in 2019. So the pre-conference process started after we had surveyed the international community and for priority areas for this guidelines process. And then we invited our expert panel, and then we generated with the expert panel clinically relevant questions in 6 priority topic areas. We then, from those clinically relevant questions, conducted a systematic literature search in June of 2019. And then we included all the articles meeting a priori criteria from this literature search to generate evidence tables, which were used as the basis for recommendation development by the topic groups within the panel. So from there, we met in November 2019, and we went through a very structured, intense review and consensus process. And we discussed the recommendations from all 6 topic groups, and discussed, revised, voted, discussed, advised, revised, voted, until we approved recommendations for each topic group. And our aim was to approve 6 recommendations for each topic group, which is what we did. And we had decided a priori that we would only approve and publish recommendations where we had more than 80% consensus. So this is what we generated, and this is what we have presently. So this is a funny looking table, but I've set this up because I wanted to show you how what our priority topics were for the 2020 guidelines, or 2019-2020, which was nosebleeds, GI bleeding, anemia, liver vascular malformations, pediatric care, and pregnancy and delivery. However, when we published the HHT guidelines this past year, we also included those recommendations from the first guidelines process that we still considered to be current. And those included recommendations regarding lung AVMs, brain vascular malformations, diagnosis of HHT, including clinical and genetic diagnosis, as well as some of the original epistaxis guidelines as well. So for the next few minutes, I'm going to go through these 56 recommendations. No, I'm sorry, I won't, I promise. I wanted to show you this mostly so that you would understand what the overall content is. What I'm actually going to do in the remaining minutes is try to talk to you about how we are trying to take these recommendations, the next few steps to getting them, as I mentioned, to clinicians and actually into not only disseminated, but also implemented in HHT care. So this will be the next section of my talk. I'm going to talk about how to access the guidelines. And what I mean here is the broad sense of how to access the guidelines, meaning how to make sure that clinicians can access the guidelines and patients can access the guidelines, and patients are getting access to care that meets the HHT guidelines standard. So before we go on to the next steps of how we've gone about this, I'm going to ask Nicole to run our first poll, please. So if people can please answer, I can read it out if you like. Oh, it seems like it's happening. Okay, good. Okay, looks like we have more than 80% of people have voted. And so we can review this. So this is, the first question was, have you discussed the HHT guidelines with your doctor? And I'm really excited to hear that 42% have already. We'd like it to be even higher, but this is a pretty good place to be starting only a few months after the guidelines were published. So that's excellent. And then the second question, have you visited the HHT guidelines website? 62% have, so that's also really good news. We've done a number of things to try and get the message out about the HHT guidelines website, as we think it's really a great home for people to be able to access it. So that's encouraging. Thank you. Okay. So, sorry, I've got it. I don't know whether I stopped. Okay, good. So what I'm really going to do actually in the next slide here, sorry. Okay. Okay, so just to talk about the overall approach to disseminating the HHT guidelines first, and because this is really the key to defining the standard of care, to getting the message out that the HHT guidelines are the guidelines that determine the standard of care for HHT patients. So we've had a number of our panel members and others who have published in journals, have published newsletters, have published highlight articles by topic and by specialty, highlighting the important aspects of the HHT guidelines for clinicians in that area. We've also been presenting similarly to in rounds at conferences by specialty, often to highlight what's new for clinicians. And then I think probably one of the most significant things we've done is set up the guidelines website, not just because we have a website, but because of how it's allowing people to access the guidelines. So I'm going to show you that in a minute, but the highlights I think are the patient care checklists that we have developed with Cure HHT and have posted on the website, and that really function each one in parallel with the topics of the guidelines. And the idea is that these checklists would be something that a patient could bring to their doctor and say, hey, can we go through this and make sure that I'm getting the care as recommended in the HHT guidelines? In addition, the guidelines is being translated into multiple languages. And finally, as you know tonight, that Cure HHT is putting on this webinar series for clinicians and patients to learn more about the guidelines. And in fact, tonight, like my role tonight is really to introduce this series, and it's going to be a series of 8 or 9 webinars, each one about the topic areas in the guidelines. So I think this is going to be a really outstanding series, and I encourage you to attend all of the chapters of it, so to speak. Okay, so now I want to show you the guidelines website. We're going to go there, and I'm just going to stop sharing for 1 second here so I can show you. Okay, success. Unless I hear otherwise from you, Nicole, I think that we've got the website up. So the next, just gonna move this away here so I can see everybody. Okay, so this is hhtguidelines.org. I hope you can see that on your screen. The guidelines website is really quite simple. I mean, there's a front page that has some details about it, some descriptions, but I think the most important things on the guidelines websites are the publications tab and the resources tab. The guidelines tab itself has the guidelines listed by, okay, that was not expected. Here we go. Has the guidelines listed by topic. So let's say we wanted to go look at GI bleeding and management. We could go look at that tab. There's a brief description. It shows each one of the guidelines recommendations. And then for each one of these recommendations, they can be expanded and there's details about what level of evidence the recommendation was based on, and what the strength of the recommendation was, and what the panel agreement was on voting for that recommendation. And then there's some other tools on the sidebar, including references, etc. So each one of the topics, so for example, if a gastroenterologist wanted to know what HHT guidelines had to say about management of digestive aspects of HHT or GI bleeding in HHT, then they would go to that tab. The publications tab is one of the things that makes the guidelines really easy access, because people often have trouble getting medical publications because you have to be part of an organization or have a subscription to a journal to get them. But we made sure that the HHT guidelines were open access, and we've also posted them here on the website so that people can very easily just come here and download the executive summary or the online supplement and any of the appendices. So it's all available here. We also put the first guidelines here as well, which is also open access, so that these were easily accessible for anybody. So if you're talking to your doctor and they say, well, where do I find this, or what's the reference for this? You don't even have to send them to the Annals of Internal Medicine publication. You can just send them to hhtguidelines.org and they can download it right from here. And then this is I think my favorite tab of all, the resources tab, and it's because of the HHT Care Checklists here. So this, I think, is a really practical way of bringing the guidelines for patients to bring the guidelines to their doctors. And in a rare disease, I think that's often the best route, the best pathway to get information to doctors looking after people with a rare disease is through the patients. And so this really, the idea is to put some tools in the hands of people that have HHT so that they can impact their care. So the way we did this, the way we set up these HHT care checklists is we made one, I'm just going to scroll down first, we made one that corresponds to each one of the topic areas. So there's a liver one, there's a GI one, there's anemia, there's also one, for example, lung AVMs based on the first guidelines. We made a current checklist, even though lung AVMs were not readdressed in the current guidelines, they're still published in the current guidelines from the 2009 version. And they're still, of course, very much part of what we think is important in HHT care. For example, we wouldn't want to, we wouldn't want to forget the message or not make clear the message in that all HHT patients should be screened for lung AVMs and treated preventatively if they have significant lung AVMs. Even though lung AVMs were not a topic for the 2020 guidelines, they're still very much part of 2021 management of HHT. So we made a checklist for each one of the topic areas, including the topic areas where we brought recommendations forth from 2009. And then we also made an overall checklist to help people sort of navigate which checklists to bring and how to make up kind of their own portfolio for their HHT care. So there's a description here suggesting that you start with this checklist and that you add all the other checklists that might even apply, even if you're not sure. So if you're not sure whether you have HHT related GI bleeding, you can pull up that checklist as well and take that to your doctor as well. So if we look at, for example, the My HHT Care Checklist, and this is the way each of the checklists are designed. First, on the right-hand side, there's a description about the guidelines and what it is, how you can connect with the guidelines. And then there's a description about the topic, but this one's the overall. And then there's some points, some check boxes that you can take this document to your doctor and say, I want to talk through this. And this particular one for the overall checklist also makes reference to the other checklists. Okay, so let's go and look at one of the specific checklists. It'll be a little bit clearer. So I'm going to pull up the, let's do the nosebleed checklist. So this is now how all of the topic checklists are structured. So the front page is what I showed you before. So sort of how do you interact with the guidelines, a description of this particular topic. So nosebleeds or epistaxis in HHT. And then these series of checkboxes are connected, really, they're in parallel with the recommendations that we have from the HHT guidelines. And on the back page, we call it, or the second, and in this case, second and third page, are the actual clinical recommendations from the guidelines document. So basically you can bring, page 1 is for your discussion with your doctor, but the pages that follow page 2 and page 3 here are the specific recommendations that your doctor would need to read. And then of course they can go and get more detailed from reading the full guidelines document. So for example, one of the things that we recommended in the current guidelines, let me come here. So the second recommendation here is we recommend that clinicians consider the use of oral tranexamic acid, which is a medication that we often use in HHT, and that it be recommended for the management of epistaxis that doesn't respond to moisturizing topical therapies. Okay, so this is one of the new recommendations in the current guidelines. And on the checklist, it says, my nosebleeds still bother me despite moisturizing topical therapy. So despite putting a lubricant in the nose to protect the nose every day, my nosebleeds are still bothering me. So then under the bullet underneath here, or the checkbox underneath is, see my doctor about treatment with tranexamic acid tablets. And then see an HHT experienced physician too. This is about another recommendation about ablative therapies like laser, radiofrequency, etc. I'm not going to go through all these, but I wanted to show you how this part corresponds to the recommendations that are here. First about the tranexamic acid, and secondly, here's the one about the laser, etc. And that each one of the checklists is made like this. So our goal with making these checklists is to try and make it easy for patients to be able to go to their doctor and say, I think that I want to talk through my nosebleed care with you and make sure that I'm getting the treatment that I need. Okay, I'm going to go back to our presentation here. Okay, so so I think you may understand now why I was saying I think the website is probably one of the most important steps that we've taken in terms of and that we've made available to help us bring the guidelines to patient care. So I'm going to, so though I was talking about how to access the guidelines, really this sort of segues very naturally into how to bring the guidelines, really home to your care. So this is our number one recommendation, really, is using these checklists to bring the guidelines into your doctor. So before we finished, we wanted to do one more poll. So Nicole, if you can launch the next poll, that would be great. I don't see it, Nicole. I'm not sure whether.
Yeah, I'm trying to pull that one up. Hold on one second.
Okay, no problem. I surprised you.
No. Okay, so everyone should see that if you can answer.
Oh, this is warming my heart already. Wow, well, this is really good to hear. Thank you. I'm really excited to hear that all of you are saying yes, that you would feel comfortable, because that's really our goal. And I said to Nicole before the presentation, if it turns out they all say no, then we'll use the whole question period to figure out what we need to do next to make it to make it accessible. So I'm really happy to hear that that's that's how people are feeling about it. So at this point, I'd be very happy to answer questions and to discuss any input, suggestions, questions that people have.
So thank you, Marie. We really appreciate that very thorough overview of the International HHT Guidelines. And again, I want to mention that this is the kickoff webinar in the whole series, as Dr. Faughnan mentioned, and that we will be covering every topic area separately, and that you can register for each of these free webinars on our website at curehht.org. And so we do have some questions. One of the first questions was from Mary, and she asked, since I only have HHT experts handle my care, do I really need this? Other than my primary care, every other position is an HHT expert.
Well, that's a great question. You know, I think it's still useful. I think that sometimes even, you know, like I'm an HHT center doctor, and I think that sometimes patients bring questions to me that I think, okay, I hadn't thought about that yet in your case, because I hadn't understood that you were, you know, still uncomfortable with your nosebleeds, for example. I thought things, you know, sometimes the doctor's perspective is different than yours. So I think it's actually a really good way to maybe bring those discussions forward, even with expert clinicians. And you know what, I think your expert clinicians will be really excited to hear that you're reading the guidelines. It's happened to me a few times that my patients have brought the guidelines to me, and I was really pleased about it, you know. And I thought, well, yeah, good point, good you're reading that, and yes, this is how, you know, first of all, maybe I just need to clarify what we're doing and why it fits or doesn't fit with the guidelines, because you know, each person is, there are guidelines which are general, but sometimes we have, you know, always we have to tailor our approach to each person. So sometimes the guidelines don't fit well for a particular person, and that's important to discuss too. But mostly I think it's really good to have your care and the priorities of your care on the table when you see your doctor. And I think that, yeah, there's still a role even at centers.
Well, and another question that relates to sharing with your doctor is just, why is it important to share with them outside of, you know, if they're not an HHT expert? Are there any other reasons why it would be important, like for insurance or other things?
Well, I think it's really important for all your doctors to know that you have HHT, because, you know, it's sometimes things can come up that might be unusual presentations of HHT, or your HHT might influence the care or the medications you can receive for other disorders. So I think you know, the very first part of my answer is, you know, even aside from the guidelines, it's really important for all your doctors, dentists, healthcare professionals to know that you have HHT. And then secondly, I think that, you know, there may be, you know, you may want to take the overall HHT care checklist to a physician that's maybe not as involved in your specific HHT care if you've got an HHT center team. So you may modify how you use it rather than taking each checklist to your family doctor if you have a whole specialized team. But I do think in some way it could be a good tool for you with each of your healthcare professionals.
Okay, great, thank you. So Helen is asking, is there any planned research to evaluate the effectiveness of dissemination and implementation of the guidelines?
Yeah, it's a great question. We have a dissemination committee that's been really much more focused so far on developing dissemination approaches. But certainly that's sort of on our list of tasks to try and assess the impact of the guidelines and to assess the outcomes of the guidelines. One of the sort of, you know, very simple ways that we have that are easily available to us as a metric about is how guidelines are referenced, for example. So that's something with the first international guidelines we watched very carefully to see whether or not publications were referencing the guidelines, meaning other doctors and scientists and people communicating about HHT were referencing the guidelines. And we have set up sort of our metrics to do so as well for the second HHT guidelines. certainly there's a lot more that could be done, of course, from a research standpoint. And this is sort of future work for us. You know, definitely, and sorry, that's my pager, definitely a priority and a work in progress as kind of one of our next steps.
Great, thank you. So we have a question here from Jeremy, and he's actually asking, at what age is it recommended for children to get scans for possible ABMs?
You know, that's a really good question, and there are a few different parts to that. I think that I would break it down into 3 different parts, and I'm going to also refer you to the webinar that's going to be about pediatric care, because there's going to be a whole webinar about that, as it was a priority topic area for the guidelines. But I think the first part of that question is, when should children who have HHT be assessed for their HHT and screened for organ involvement? I'm going to say that rather than scanned, since scanned implies a particular test. So when should children be assessed for HHT? As soon as possible. So, you know, at birth, if we know that they have HHT, or that they, or as soon as possible in infancy, once we've confirmed the diagnosis of HHT, or if we can't confirm it, if we suspect it, or if we can't, you know, if let me take a step back. Each child of an HHT parent has a 50% chance of having HHT, and sometimes people know by the time that the baby's born whether they have HHT or not, or sometimes they do testing right at birth. Sometimes, even if they do testing at birth, though, we still don't know. We aren't always, you know, we don't always have the genetic mutation in the family to be 100% sure whether a baby has HHT or not right off the bat. So if we know that a baby has HHT, or if we can't rule it out, then that baby should be checked in infancy for lung and brain ABMs and be followed thereafter. If you find out when your child is 7 that you have HHT in your family, then 7 is the right age to get checked for lung and brain ABM. So it's basically as soon as we know. That's when, as soon as we know, or as soon as we know that we can't rule it out, but this is in our family, then that child should be checked for organ ABMs. The specifics about which tests to do and when, I really think we should discuss that in the pediatric webinar, because that's what that whole webinar is going to be about.
Great, thank you. So Marjorie is asking, how do you actually get your doctors to be willing to look at this information? Because she has to travel to a center, so most of her specialists are local, and many don't really have an interest in HHT or have any experience. And so she's just wondering, how does she really get them to pay attention to these guidelines?
Great question. I think that arriving there with a checklist and easy access to the guidelines is helpful. I think you might not, it might be harder if you arrive with all of the checklists, you know, or if you arrive with a stack of papers, then, you know, maybe that might overwhelm the doctor. But if you're arriving and you're saying, today I'd really like to talk to you about my nosebleeds, and I want to make sure that I'm getting the care for my nosebleeds that's recommended in the international guidelines. So that, to me, is a clear message to the doctor that this is what I want to talk to you about. And by the way, there's a standard, and I'm asking that I get that standard of care. And that's something that I think doctors are, you know, react to and will hear. You know, it's not 100% not the same approach is going to work with every clinician, but I think it's very reasonable to expect to be able to discuss a symptom and to be able to say, I would like to make sure I'm getting the current recommended therapy. Okay,
great. Thank you. So Mark is asking, he says, as drug trials yield data or things develop further in HHT care, is there a process for updating or revising the guidelines?
Yes, definitely. So we have a couple of things on the go. One is we have some next topics that we've already decided are priorities. So one of them is about lung AVMs. So we do want to revisit the lung AVM guidelines, and that's already underway. Not that there were major changes in the recommendations. You know, the recommendations that we have that are published now are very strong standard of care and very important standard of care, but we want to, you know, add some additional new science to some of the details of the recommendations. So lung AVMs are on the table right now as the next step, and we're already working on them. And then there's a plan to update guidelines depending on the evidence every 2 to 3 years. So we're planning a much shorter turnaround time and possibly updating only one topic at a time, as we're doing with the lung AVM guidelines.
Okay, fantastic. So our next question is there a guideline, or will there be a guideline on genetic testing?
Yeah, so actually the genetic testing guidelines are part of the diagnosis section from 2009 that were published again in the current guidelines. So yes, and that exists already.
Okay. And so do you have, the second part of that question is it important to know your HHT gene?
Great question. The short answer is yes. And you know, the reason to know it is so that people in your family can all get sorted out. That's the number one reason. So, you know, almost each family has their own private mutation. So their own family specific change in their HHT gene. And that's kind of the key to the family. So when we have, you know, when we see a new patient with HHT, and this is the first person in the family to get diagnosed, we typically will recommend that person have genetic testing done so that we can figure out the exact change that causes the HHT in that person. And then once we've got that figured out, then the other people in the family, pretty much everybody else in the family, should be tested to sort out whether they have that mutation or not. So it's really the key to the family. There has been also a lot of research over the years kind of talking about different types of mutations and what the pattern of HHT is in families who have those mutations. So for example, you know, endoglin families are more likely to have lung and brain AVMs, and ACVRL1 families are more likely to have liver vascular malformations, for example, but we have not at all geared any of our recommendations for screening or testing or treatment based on the gene mutation, because there's overlap of the different, you know, endoglin patients also can have liver, and ACVRL1 patients also can have lung and brain. So we don't want to, there is no evidence for the gene mutation to tell you what to do with someone's HHT. The gene mutation, though, really is the key to the family.
Okay, great. Thank you.
Thanks.
So we have, someone is asking here if there's any evidence about HHT and anxiety, and if there would be any guideline recommendations regarding mental health issues in the future.
Wow, that's a really good question. We do know that HHT can definitely, you know, can affect mental health, and that, you know, chronic symptoms in HHT and as in other diseases can often strain mental health. And we do, but we have not yet generated any recommendations in that regard. It's a really good question, though, and I think that it's one that we should be considering for future clinical guidelines. So thank you for that question.
Sure, thank you. So Stanley is asking, this kind of goes back, I guess, to the genetic testing in children, but his concern is that having his child screened may limit to what he can do in the future, mentioning a pilot or an astronaut, but just, you know, if you have that diagnosis in your medical record, And just asking that, do you think there's any strategy to help children not be limited in the future?
First of all, I think, I understand that it's a difficult question. I think that, and I'll tell you what I tell my patients when they're thinking of asking these questions about their kids, is that, though most kids with HHT are healthy and well through their childhood, children with HHT are at risk of the same complications of organ Abms as adults are. So, a child can have a stroke from a lung AVM or a hemorrhage from a brain AVM without there being any warning signs or any symptoms beforehand to tell us that this might be coming. And those symptoms can be life-threatening and debilitating. And so, this is where the pediatric or childhood screening guidelines recommendations come from. They come from a place of wanting to prevent strokes and hemorrhages and fatal events in children. And so, this is, of course, it's a challenging thing. You have a well child and you're thinking, why do I complicate their lives by having them do testing? But it is your only opportunity to be able to prevent those life-threatening complications, is to figure out whether they have HHT or not, screen them for that type of organ involvement, and treat that preventatively so that they can stay healthy. So I have to say that I think, each person has to kind of weigh all of those things in the balance. But this was the thinking behind the recommendations, that children should be tested early and screened and treated preventatively early.
Yeah, I would definitely agree with that. Thank you, Marie. So we have a question here. Which of the guidelines would you recommend taking to your cardiologist? Are there guidelines being planned for heart-related HHT problems?
Yes, there are. There are some guidelines related to the guidelines in the liver vascular malformation section describe in the management of what we call the high output cardiomyopathy, or the type of heart disease that can happen in HHT patients because they have HHT in the liver. And that's probably the first, that is the most common complication of HHT in the liver, and it can present in different ways, like symptoms of heart failure, or sometimes complication by arrhythmias like atrial fibrillation, and some other less frequent presentations. So the guidelines do address that, how to manage those problems and how they're connected to the liver vascular malformations. So that's the care sheet, the care checklist, I would say, to take. Yes.
Okay. And we will have a webinar on that. We're in the process of finalizing that date. I believe it will be in June, but it will be on the website as soon as we have that worked out.
Oh, can I add one other thing, Nicole?
Sure.
The other thing is that often people with heart disease, like unrelated to HHT, for example, might need to be on aspirin or a blood thinner because of their heart disease, and also some other medical conditions. And sometimes doctors think that there's no way an HHT patient could be on any of those medications, but sometimes the benefits might really outweigh the risks. So what we've tried to do also in the anemia section of the guidelines, it's called Anemia and Anticoagulation. We actually have some recommendations about how doctors can approach using a blood thinner or an antiplatelet like aspirin for people that have HHT and that have chronic bleeding. So that would be another important checklist to take to the cardiologist, because often they're considering those types of medications.
Okay, great. And that webinar, actually, we know is a hot topic. And so that's our next webinar on Saturday, March 13th at noon. And this way we can capture, the majority of the people around the world, because we know this is definitely one people have questions for. So kind of relating to that, I have a question. Are you putting out standards on your checklist relating to hemoglobin numbers with that person that does have a heart issue?
So in the guidelines recommendations, we do have a proposed approach to anemia in HHT and to what the target hemoglobin should be in people with HHT, and it depends on various aspects of their HHT and also other comorbid disease. So yes, we have done so. That is part of the guidelines.
Great, thank you. So the next question is, can my primary care doctor order screening tests for HHT? So, your local physician, how do they go about working through these guidelines?
So it really depends, it's in the short answer is yes. But it depends on the local physician's access to expertise for doing the testing. So do they have the right tests available, and can they do them in a low risk way? And then also, do they have the access to the radiologist who will be able to interpret it and be able to answer back to the primary care doc, let's say, about whether this is a lung AVM that needs treatment or not. So you see that, some of the tests can be done, but that doesn't necessarily bring you the expertise that you need. And so in general, we recommend that patients with HHT visit an HHT center. They don't have to go to an HHT center for every step of their care, but that they have some consultation at an HHT center and a connection there. So sometimes I have patients who I see only every 5 years, and in between they do their testing with their primary care doc, and there's a communication back and forth. So I can still give them the expertise that they need, but they can get their testing closer to home. Mm-hmm. So usually we try to arrange those types of, we try to make those types of arrangements. Once someone comes to the HHT center, then we can involve the family doctor or the local practitioners to continue the care in between center visits.
Okay, and related to that, we have someone who's asking if in the days of COVID that we have and more telemedicine, if you do have tests done locally, but want to get that HHT care, but can't get to a center, do you think telemedicine is an option for that initial screening if it's provided at the center?
I do. So I think that the best way to do it maybe is, if that's your plan, to have your testing done locally and then have a telemedicine consult with the center, I think it would be really wise to connect with the center first, because they may have, for example, like we often have some advice that we can give to the local docs to say, this is how you should do those tests. And then let's get those done. And then we'll plan for a telemedicine consultation, and we'll review that imaging at the same time. So we can, most of the HHT centers are very well versed in how to provide the testing, but also how to oversee the testing or how to guide it outside. And I think, I don't know if all of and I think you might know this actually more than I do, Nicole, because I know that Cure HHT has done some polls in this, but I'm not sure if all the centers are seeing new patients by telemedicine, but I think most are. Most have that capacity to do so.
Yeah, and I think more are doing it because of COVID, and that was kind of the primary.
That opened the door, yes.
Yeah. So I do think it is more of an option at many of them, and that is a poll that we need to do again and more thoroughly to provide that information, I think, to people.
Certainly us in Canada, it's become a mixed model, and so we do really a mix of virtual and in-person, and it depends. It all depends on what the person can have locally, and whether we think it's really important for them to be assessed in person too, because there's some things that we do in person that aren't tests, that aren't imaging, that have to do with physical exam, etc., or treatment. So it really depends. It's case by case.
Yeah, and it's interesting because I've had a couple of telemedicine appointments myself, and they're actually on time.
That's good.
There's no waiting in the waiting room.
That's good. I'm not sure it's been 100% on time on my end, but we sure try.
I've been impressed. Yeah. So I have a question here from Karen. She's just asking, based on the 2009 standards, since they had been out longer, did you find that most doctors really were willing to follow the standard, or did you hear that patients really kind of needed to fight for their care?
So it's a good question. And that's, I think that can be kind of regional and depends on which part of HHT you're talking about. I think that there are a couple of areas where we had very strong recommendations in the first guidelines where I think there has been a very good uptake, for example, about screening and treating for lung ABMs. Whereas there are other areas that have still, you know, we didn't have very strong recommendations from the first guidelines about nosebleed management, and there wasn't a lot of evidence, and this has remained, I think, quite variable what access people have to the different types of care and what sort of things they're being offered. One thing, though, I can't provide, I don't have any data about non-HHT centers and their adherence to international HHT guidelines, but I can tell you that we recently published a survey that we did of all the North American HHT centers, and 100% were screening all adults for pulmonary AVMs and treating them preventatively, and close to 100% were screening children in the same approach, with the same sort of approach. And those that, and 100% were screening adults for brain AVMs, and again, close to 100% were screening children for brain AVMs. So I can speak to the consistency across HHT centers of screening, and I think that's an important place to start and important for us to communicate, because I think that is another way too of sort of saying to other clinicians and centers that not only is there a guideline, but this is the standard of care. This is what we're doing across all HHT centers very consistently.
That's great. So I have a question that is related back to the genetic testing, and it's just asking, does the number of generations from the first person getting tested matter? So does it really matter who's the first person to be tested in the family?
It doesn't really. You know, for example, like there's sort of every family has a different process that you know, it very rarely is the exact linear process that we would recommend. For example, if I see somebody who has a definite diagnosis of HHT, and I send them for genetics, and they have 3 adult children, and their adult son says, I'm not ready to deal with this. I can't deal with this. But the grandson, you know, has nosebleeds, and it's possible that even though the dad doesn't get tested for HHT, if the grandson wants to get tested for HHT, or if the family wants to test the grandson for HHT, they can use the grandfather's genetic test results to determine whether the grandson has HHT or not, even if we haven't tested the son in between. Okay, so it doesn't matter. And you could even stretch out another generation. That doesn't matter. Basically, once we know the mutation in the family, anyone in the family who's trying to figure out if they have HHT can get tested for that mutation.
Okay, great. And we have one more kind of direct medical question, which is, are there any concerns about general anesthesia when a patient has hepatic VMs?
So, so when people have liver vascular malformations, it can cause, as I was talking about before, this what we call a high output cardiomyopathy, or a heart condition related to the liver vascular malformations. And people with a heart condition can sometimes poorly tolerate a general anesthetic. So I think it's more about that, about the heart, than it is specifically about the liver. Okay. So if somebody has HHT in the liver, then they should, this should be discussed at the pre-anesthesia consult, and precautions should be taken to avoid sometimes people have HHT in the liver and they have some strain on their heart, but they're functioning just fine with it. It's basically their heart's out having to do extra work, but they're functioning just fine with that. They have no symptoms of it. But when they go and have a surgery, it's possible that the extra fluids you get with the surgery, or maybe being anemic after the surgery, those kinds of things can add some strain to the heart and can cause the heart to decompensate. So it is important for people that have significant liver vascular malformations that be discussed before surgery. There's a range of liver vascular malformations, really. It's a continuum. So it's probably not the people with 10 telangiectasia in the liver that need to worry going to a surgery. It probably doesn't matter one bit. It's the people over on the other end that have hundreds or thousands of telangiectasia and who have, a very high flow through the liver, or have had heart complications or symptoms from the liver. So it's the people who have the more severe HHT of the liver that should be getting some advice and discussing this with anesthesia before surgery.
Okay. And our last question for the evening is, would you recommend going to a children's hospital for an initial pediatric screening? Are there benefits to that versus, just going to another HHT center?
I think I would talk to the center that, that you're dealing with. So often, that most of the adult centers either have a pediatric clinic, adult HHT centers either have a pediatric clinic connected to it, or they have advice about about where you should get the screening for your children. So I would say start with the adult HHT center and say, what should we do to get screening for the children? Because sometimes just going to a pediatric center, if they're not an HHT center or HHT knowledgeable, it might end up leading to more testing. Or maybe less testing than needed. So I think it's good to come at it from the point of view of the advice of an HHT specialist.
Okay. And we have just a general comment that I wanted to share from you, which was, what a phenomenal resource for patients and physicians. Thank you so much for all the diligence and care taken to make these guidelines so accurate and user-friendly.
Well, thank you. Thank you for that feedback. And thank you for all the great questions. This has been a great discussion.
Yeah. So
it's a real pleasure.
Well, and we really are grateful for everything that you did to make these a reality, and for doing it twice, and for continuing to work to revise them, because I know it is a lot of work. And so on behalf of Cure HHT, I just want to thank everybody for attending tonight's webinar and staying connected to us. Cure HHT is the only patient advocacy organization in the world for HHT, funding research and advocacy and providing educational materials, etc. So just know we're here for you, the entire community of patients, families, healthcare providers, and researchers. And we're just extremely grateful, as I mentioned, to Dr. Faughnan and to the McMahon family for their commitment to pay it forward so that future generations have more effective treatments and ultimately a cure for HHT. Because without their financial support, this event would not have been possible. And we appreciate the fact that several McMahon family members attended the conference in Toronto to be a part of this landmark event. So just remember, if you haven't received your complimentary copy of the, it's not showing up well, but of the Managing Your HHT with all the fact sheets and guidelines in there, let us know by completing the Join Us form on our website. In addition, after the webinar, you will receive a short survey. So please take a few minutes to complete it so we can better serve you in the future. I just want to again thank Dr. Faughnan for volunteering her time tonight to present this webinar, and it will be recorded and posted on our website and in the resource library. So we appreciate your participation. We hope you enjoy the rest of your evening. Good night, everyone.
Thank you. Take care. Thanks.